So the MONALEESA-7 was a trial that enrolled specifically premenopausal and perimenopausal patients that were maybe in the transition but still having periods, to a trial that now incorporated blockade of the ovaries using a monthly injection called goserelin. So it essentially puts them in a menopausal state. And the reason that this was done is not only because the prior trials were done in the postmenopausal state, but we know that the older drugs that are used in combination with the CDK inhibitors work better in the postmenopausal state. So this trial was unique in that all these patients were premenopausal, and they started on ovarian blockade right at the time that they started on treatment. And we assumed and hoped that it would give the same benefits that we've seen in the postmenopausal state. And in fact, the results showed that it did. That it doubled the progression-free survival, that is, the average time that patients would go before their cancers progress. And this trial allowed both aromatase inhibitors as the endocrine partner to the CDK4/6 drug as they're combined, or it allowed tamoxifen. This was the first trial to look at tamoxifen, which is an older drug that is used in either pre or postmenopausal patients. And this is important because it gives us more flexibility. A lot of patients have side effects of aromatase inhibitor therapy that may be really bothersome to the point that it's interfering with their normal life. And tamoxifen oftentimes is substituted, but we never knew that with CDK4/6 inhibitors we could do that. So this trial established two important steps, which are important steps forward. One is that we can confidently treat premenopausal patients and get the same results we've been seeing in the postmenopausal trials. And number two, that tamoxifen can be used either as initial treatment, or if patients are having a lot of side effects from aromatase inhibitor, can switch over. We found that the side effect profile was pretty much the same as has been seen in other trials. And we also looked at quality of life from patient surveys. And we found that over time, quality of life can fall sometimes if patients have recurrences or as their cancers progress. And the patients that were on the Ribociclib arm, that was the CDK4/6 inhibitor used in MONALEESA-7, on the Ribociclib arm actually had a less of a deterioration, so they did have a benefit as well. So altogether, I think this is an important advance, particularly for younger patients.